Hello, and welcome back to Pets Deserve It. We are your hosts, Jessica
and Dr. Megan,
co-owners of Latah Creek Animal Hospital, Spokane's premier fear-free certified practice. We're so glad you're tuning in to our podcast. New episodes will drop on the first of every month.
In our last episode, we discussed why you should care about fear-free. To make a long story short, it's because stress is incredibly toxic and can have long-lasting ill effects on both their physical and emotional health.
Emotional health, that's the key there.
That's the key. Yeah.
Okay, nice.
So go check that episode out to learn more.
So why recognizing stress is crucial? Stress affects your pet's emotional and physical well-being. Understanding the signs of stress helps you intervene early. And when your pet can be low stress, they can live a happier and healthier life.
It's important.
It's important. Yeah, a lot of things in here are important.
Yeah, everything one might say.
Everything.
All right, so let's get right into it. Today we are talking about how to recognize stress in our pets. This is important because if we can't recognize their body language and subtle stress signals, we're not going to be able to realize that there is a problem. And we won't be able to help them if we can't accurately assess their stress levels. When your pet feels unheard, they're going to escalate their signals. Basically, it's like us. If whispering doesn't work, they're going to shout. And escalating their behavior up the ladder is appropriate in pet language. While biting is not appropriate ever to humans, if they feel unheard and they are escalating their behaviors up the ladder, which we're going to talk about in a minute, to them, they're doing what is appropriate for their species.
It's very interesting.
Yeah, I'm not saying biting is okay, but they think it is. And if we have to listen to them too.
And I think if we can really sit down and look at what signs we were showing leading up to that, we might all think it was warranted.
Yeah.
In dog language.
In dog language and cat language.
And cat language.
So we're going to go through species by species and talk about both the subtle and not subtle signs of stress. Let's start with dogs.
Okay.
Hit it, Jessica.
Our dog friends.
Our dog friends.
Okay. So let's start with facial expressions. So you might see a furrowed brow.
Mm-hmm. Just like us.
Yeah. Yep. Some are more expressive than others.
Yes. Just like us.
Ears to the side or back. Pursed lips or lip licking. Mm-hmm. Whale eyes.
What's a whale eye? And for those who are listening, not watching.
So the whale eye will be when their eyes are just open really as wide as they can be and you can see all of it. Mm-hmm. The whites all
the way around. Mm-hmm. Yeah. Boy, for those listening and not watching, you are missing out on some demonstrations of facial expressions here.
A clenched jaw and just tense overall.
When my dog does this, I call it the squinchy face because all of him looks squinched. Except his eyes, obviously, are whale eyes. But everything else, his lips are pursed, his ears are back, his brow's furrowed. It really is quite obvious.
Okay.
Squinchy face and big, wide open eyes.
Okay, body postures and behaviors. So looking away and avoiding eye contact. So you'll see that they might just kind of look away or not want to look at you, but also you want to be mindful not to make eye contact.
Right, not to stare them directly in the eyes. They should be looking kind of towards your face. I mean, think about people. We're looking at each other, we're talking, but if they're staring right into your eyes.
Sniffing the ground or not wanting to interact.
Sniffing is a displacement behavior and it's calming for them. So you might be trying to get them to come over to you or get their attention and they seem inordinately focused on something on the ground. They probably don't really care what's there, especially if we're inside or in a normal environment. There's nothing there. They're just trying to displace the tension.
And avoid. Okay. Which brings us to our next one, avoidance. Just not wanting to interact.
Mm-hmm.
Salivating, urinating, defecating.
Defecating? He defecated.
He defecated.
How about the morning to ya?
Salivating, urinating, and defecating. This one is rather self-explanatory.
It is. And quite obvious. You won't miss this one.
Nope. This one will be front and center.
Mm-hmm.
Yawning. I think we've all seen our dogs yawn, and we might think they're yawning. Usually it is a nervous yawn.
It's a nervous yawn. Another tension displacing behavior.
And then panting. Yes, sometimes they pant, but often it's a sign of being nervous.
Especially if they're not hot.
Yeah. Oh.
It keeps going.
Okay.
There's a lot.
Okay.
There's a lot of these, guys.
Okay. There's a lot to pay attention to. So focus.
Yeah. So when you think, wow, it's like they're just reading my dog's mind. We're not reading their mind. We're reading their body language.
Okay. So either not eating treats, we're just generally not interested at all, even though under normal circumstances we might want those treats, or sharking the treats, which means they're taking them from us so rapid fire, their brain can't stop taking them. So that is also a sign of stress, that we are just eating, much like I do sometimes.
Yeah, me too. Stress eating.
One might say, that they just can't stop.
They're almost displacing their stress by eating.
And sometimes we might see our labs who are usually pretty good eaters.
Yeah.
And sometimes we even have to stop and think, wait, actually, he is sharking the treats, and we need to be mindful of that. Shaking, just general shivering, shaking type
That's another
behaviors.
one that most people don't miss.
Yeah.
Yeah.
They're doing the paw lift.
The paw lift. What's the paw lift?
So when they're sitting there, they might just be, if you can watch me, lifting up their paw, almost in a like, don't touch my paw type of way, but
it's very submissive.
Yeah. Cowering or rolling over, again, very submissive behaviors. There might be some urination happening at that time as well.
And we have to be careful to think they don't just want a belly rub.
Right.
You can usually tell. Again, we're looking at the facial expression and we're looking at these other behaviors. Does our big lab, again with our labs, right? Does our big lab come in and just flop over on his back with a big old happy smile on his face and a loose body position? He wants a belly rub. If it's urinate, paw up, roll over, stiff, squinchy face, whale eyes, we probably don't want a belly rub.
Right. Sleepy face. I'm not sure I know what this is.
Sleepy face it's another more submissive displacement behavior where they're trying to make themselves look non-threatening so we don't hurt them. And you'll see it looks like a sad face or a sleepy face.
Okay.
Just think of your shelter dog in your ASPCA commercial. They're not doing like the squinchy stress face. It's more just the sad eyes, everything downturned, droopy, hunched.
Oh,
very sad looking.
So sad. Pacing. We get a lot of this in the exam room, just pacing back and forth and back and forth and back and forth and jumping up and jumping down. And we have shake it off.
I'll stay out too late. Bum, 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 got nothing in my brain.
Little Taylor Swift break. Okay, so shake it off. So
like Taylor Swift.
Yep. So that might mean we've had a stressful time, and then we walk away and we shake it off.
Yeah, it's a full nose to tail shake. It looks like they're shaking off water.
Okay. So much like when you're dancing, you're just shaking it off.
You're shaking it off
because you had a stressful day.
Like Taylor Swift does.
Okay.
And why is that a good thing?
That they're shaking it off?
Yeah.
They must be feeling better.
They're feeling
and
better.
happier and less stressed.
From what, though?
And they're like, we're done.
Yeah.
They get this sense of like, my exam's done. I'm feeling good. I'm going to go over to my mom and I'm going to shake it off.
Yeah.
Yeah?
Yeah. And if you see a shake it off and you don't know why, they probably were stressed. And that's a good way that you can look back and say, ooh, something I did was putting a lot of pressure on them.
Yeah, what were we doing?
Yeah. So the shake it off is a good thing. But then what was coming before it can be a good indicator. Yeah, of what your dog was feeling.
Okay. All right. Well, let's shake on to the next one.
Okay, I'll take this one.
Okay.
Again, if you see these behaviors, the next set is quite obvious. If you see these, we call them offensive behaviors because I don't think they're necessarily being aggressive. They just have had their signals ignored and they're trying to communicate. Most of the time. We're not talking about behavior problems here. We're talking about normal dog communication. So if you see any of these behaviors, you're not going to miss them. But sort of like the shake it off, but in a less positive sense, what did you miss leading up to this? It can be good learning for both at the vet clinic. Boy, if they do this, we sure miss some signals, and at home. For some dogs, the best defense is a good offense. So we'll just go through these. These are, no one's going to miss these. These are bared teeth, tail up, barking, growling, coming forward towards you, very big body position, chest forward. They are trying to show you that they're the big dog.
At the dog park.
Or at the vet.
I'm the big dog.
The big dog.
And
oh, go ahead.
I was just going to say, your vet or people have probably told you, ooh, he looks aggressive. Oh, he's mean. Oh, he's fill in the blank of words that are most likely not true.
No, he's not, for the most part. he's not mean. He's just trying to communicate. He's scared. His signals have probably been ignored because most dogs, again, dogs without behavior problems, we're talking our normal pet dogs here, are not going to go from asleep and relaxed and happy to biting you. There was a whole ladder that happened before that. It's just, as you saw from what we talked about a minute ago, it can be quite subtle.
Yeah.
An eye position, a lip position, a paw lift. These are things that are easy to miss, and then we think he bit out of nowhere.
Yeah.
But he didn't. So that's the end of the ladder, is biting. We went too far. We ignored some signals. We ignored a lot of signals on the way.
What does a wagging tail mean?
What does a wagging tail mean? Does it always mean they're friendly?
No.
No. A wagging tail means that they want to interact. It's as simple as that. A wagging tail just means willingness to interact.
Which could be good or bad.
Which could be good or bad.
Okay.
There are different tail positions, whether it's kind of low and loose wagging like this if you're watching, but we can all picture a happy dog tail. If it's straight up and vibrating wagging, more like this, that is more of a offensive tail wag in terms of, okay, I'll fight you if I have to. I don't necessarily want to, but if I have to.
Okay.
So there's just as many variations in tail wagging. Just know, but his tail was wagging. How was it wagging?
Yeah.
And what did the rest of his body position look like, more importantly?
Or was his tail tucked?
Or was his tail tucked?
Submissive. More type behavior. Yep. Yeah. So all of this makes me think about these videos that I see all over social media where somebody posts that someone's child, usually children are involved, but it could be anybody. Somebody gets bit. And the caption is, he bit them out of nowhere.
Did he, though?
Do we actually bite out of nowhere?
No.
So then the videos that you see they're slowed down, and now this person has pointed out 10 to 15 of these steps on the ladder that the dog is showing: ears, eyes, drooling, tail, lifting the paw, like the child's getting close, we're lifting the paw, and then the dog, in this case, or the videos that I mostly watch, then makes an attempt to try to bite the child.
And that is where they, again, in their own language, that's where we speak two different languages. It is not appropriate ever in human language to get bit by a dog. So I'm not here advocating dogs biting at all.
No.
But what I am saying is, if it's appropriate in their language, they don't have a behavior problem. Then there's a lot of things that we can do to make those bites not ever happen again.
Yes. A lot of management that can happen.
A lot of education, learning to read them, and really very much easier to prevent these bites. So this was a lot of different signals. Let's put it all together a little bit. In fear-free land, we have 6 levels of FAS, or fear, anxiety, and stress, for those of you who missed the first episode. If you did, again, what are you doing? Pause here and go back and listen to that one.
Yeah.
It's pretty great. But moving on, for our loyal listeners, FAS goes 0 through 5, 0 being the happiest and 5 being the most stressed. So we're going to go through and put a lot of these signals together by level to give you an idea of what you might see, when it might be more subtle versus more obvious, and again, how close we might be getting to a bite.
Okay.
Well, we'll start with 0.
FAS 0.
FAS 0. What does a happy dog look like?
What is a happy dog?
We can all picture that golden retriever, right? He's got a loose body language. He's trotting up to you. His tail's wagging, kind of low to middle, very loose, again, very big sweeping tail wag. His eyes are soft. He might have his mouth open a little bit, and his ears are flopping. He's coming up to you all happy. His eyes are soft. His face is relaxed. He's looking at you, at your face, but not staring into your eyes.
He'll take some treats.
He wants some pets. If he rolls on his back, it's really loose with his paws up in the air and happy. Picture this dog. That is your classic happy dog.
Yeah. So sweet. Okay, FAS 1. Not quite as outgoing as FAS 0. Maybe more thoughtful about things, but then realizes that things are safe and will come and start to interact. Maybe a little bit hesitant about the treats, but then starts to take them, and the look just starts to relax a little bit more.
This dog might stroll up to you rather than running up to you like a golden. Or he might wait till when you sit down, and then he might come over like, oh, it's okay.
And just sort of maybe eases into being relaxed and calm.
Yeah.
Like, oh, this actually isn't so bad.
Yeah.
Okay, now I'm happy.
Okay, I'm happy.
Yeah.
He might not flop on his back for a belly rub, but still very similar soft body language.
Yeah. Good.
FAS2, now we're starting to see some subtle stress signals. We're starting to see a lot of the facial expressions, the lip lick, the whale eyes, the furrowed brow. We may have a slight reluctance to approach. We're not going to see the louder displacement behaviors, the sniffing, the avoidance, but we might be more hesitant to come over. We'll take some treats, but we're thinking about it. Normally, these dogs can be won over if you have good body language and good dog skills.
And often in the exam rooms, they'll take the treats if you guys are doing like the toss game or something, the treat toss game.
Yeah.
Okay.
They need a little bit of convincing that we speak dog, that we're not going to hurt them. But in general, if you know what you're doing and you respect them, they're not going to escalate very much, if at all.
Yeah.
In fact, you can still usually get these to de-escalate just by how you're acting and what you're doing.
Okay. Nice. FAS3s, in the vet world, in Fear-Free Land, one might say these are the hardest to read.
And probably these are the ones in the videos you're talking about, too, that then escalate through the ladder because they're so hard to read.
Yeah. And these are the ones that, as the vet team and as clients, can be more difficult to read.
And why is that?
FAS3. These are our patients that are usually just frozen, which is one of the reasons that it makes it difficult to read them. Because those less educated in a clinical setting are tempted to say, but he's fine, he's just standing there. We hear that a lot. Oh, he's just standing there.
He did great.
Yeah, he did great today. He's just standing there. Yeah. The facial expressions will be key here. They are being very still, but they're not eating. They have whale eyes. Their tail is tucked. They have squinch face. They could be shaking, avoiding eye contact. Again, not to make direct eye contact with you, but they're just going to be avoiding looking in your general direction. And they will not approach you. So mom's on the bench. We're standing in front of them, but we're doing great because we're just standing there. We're not doing anything. And maybe mom can't see the face, but we're looking at the face and we can pick up on these things. But that's why it's so hard, because the owners think we're just standing there. And we used to think that too.
We used to think that too.
This was a very difficult one for us as well, both in reading them and then discussing through it and convincing the owner that these things were happening.
Like, you won't give him the shot. He's just standing here.
Exactly.
He is just standing there, but he's frozen and terrified.
But he's told us, again, in 4 to 6 different ways that he may be forced to respond differently if we do not read what is happening. So we'll talk a lot about FAS3s. This is where we start to require PVPs to come in to be seen, as much as we think they can benefit most everybody on the scale. FAS3s is where we have drawn the theoretical line for PVPs. Again,
PVPs being the pre-visit
pharmaceuticals. You got to get down with the lingo.
Yeah, you gotta
no cap. We got our own lingo, much like the younger generations. But FAS3s are really, really difficult. So we will spend a lot of time throughout these podcasts talking about them. They probably take up the majority of our day when we're seeing patients, the FAS3s, because again, still, even as of now, it takes a lot more educating on this one to show clients that we're not just good and standing there, that we are actually frozen, and that actually is displaying a body language that they are stressed.
And just because we don't understand doesn't mean they're not trying to tell us.
Yeah.
FAS4s and 5s, I'll talk about them just quickly at the same time here, because these are not signals that you're missing. FAS4 and 5, really, we're getting to where they feel quite similarly, but in the fight, flight, freeze, or fidget response to stress, FAS4s are more extreme flight, and FAS5s have gone up the ladder now to fight. But internally, the feelings are quite similar. They're just responding a little bit differently. So with FAS4s, again, we're seeing extreme avoidance behaviors. We're not seeing frozen or sniffing the ground in avoidance. We are climbing at the vet. We are climbing on the bench, trying to hide behind mom. We are pawing at the door. If you walk towards them, they dart the other way. They are trying their best to get away from you. And if you corner them, often they will escalate to a 5, which is where we're lunging, we're growling, we're barking, we are potentially biting. And those dogs, if they could speak English, would be shocked that we told them this was not appropriate, because they would say, but they were threatening me. I mean, in their mind.
Right. Like I moved to the corner. I'm actually cowering in the corner and very possibly urinated on myself.
Mm-hmm.
And I'm terrified. And you're still coming at me to give me my injection.
Yeah.
I'm going to have no choice but to growl, snap, potentially bite.
Yeah.
And then at that point often is when some might get a little bit rougher in the handling and trying to force things on these patients.
Or we stop not because we're respecting them, but because we're calling them, not us, but some are tempted to call them a bad dog or an aggressive dog. And they are just trying to tell you how scared they are.
Very outwardly.
Because we didn't listen.
Very obvious. And these signs, you can't miss these signs.
You can't miss these signs, but you missed a lot of signs before that.
Yeah. So now, I guess we also don't want to take away the fact that sometimes there are dogs that are aggressive.
Absolutely.
And are going to bite you.
100%.
That is just not as many as we think.
Correct.
Like, we get patients referred to us that this dog is aggressive, he will bite, he may need to be euthanized, but with proper handling and PVPs, the visits have actually gone very neutral.
Yes.
He's gotten the care he needs. We've respected his boundaries and his signals, and we've had successful visits.
And the key here between, I think, aggression and just a FAS5 is, are they going through this ladder? Are they trying to tell you to stop and then you do and then they de-escalate? That's all appropriate. I'm scared. Please leave me alone. Oh, okay, I'll leave you alone. Oh, okay, great. Thanks.
Yeah.
Or are we actually, for an example of aggressive behavior.
How often are these patients actually diagnosed aggressive?
Maybe 1% of the time.
Okay. That's good information to remember.
Very, very low amount. A true aggression, for example, rage syndrome. How rage syndrome generally presents is you are sitting on the couch watching TV. The dog is over on his bed. You have not changed your position. Nothing's happening. You're at home. And the dog comes up out of nowhere and starts attacking you and won't stop. That is an example of an aggressive disorder.
Like true aggression.
That is a behavior problem. We are not going up the ladder. There are no triggers other than electrical activity in the brain. But there are no outward triggers that you can alleviate. That is a actual behavior diagnosis disorder.
But what's happening in the veterinary clinics and in the homes is that because we historically don't recognize these body languages, then we're labeling these pets as aggressive. And most of the time, that's just not the case.
No, it's not. And as a side note, if this is his 8th vet visit and his signals were ignored at the 7 previous visits, he's not going to go through the ladder because he's already learned that this didn't work. But that is still different than a diagnosed aggressive behavior problem because he just learned that. Well, when I go in here, I tried to give him the whale eye and the brow and the paw and the avoiding and the sniffing and the freezing, and none of that works. So I just have to bite. That's the only thing that works. And they learn that at home as well. They can learn that anywhere, but that is still more of a learned response to stress than an actual behavior diagnosis of aggression.
And I think one of the things that we have learned about some of our highest stressed patients is that they are wonderful and amazing family pets, companions, and it just something has triggered them at the vet or the groomer or wherever they've been going, but they're just amazingly fitting into their family and the lifestyle that they've been given, but something triggers them at the vet.
Yeah, that's another key point. Are we pretty much good at home and then in these certain situations, which isn't always the vet, sometimes it's the groomer, sometimes it's on walks, sometimes they're scared of other dogs.
Yeah.
Reactivity is still not the same as aggression, but we're not talking about that today. That's for the future, so stay tuned.
That's for episode 42.
Yep.
Okay, we want to be able to give an appropriate amount of time to our kitty cats. So let's jump into that.
Traditionally, we have a harder time reading cats. I think we are just not as used to their body language and signals. We find them to be more subtle. Actually, they are very expressive if you know what you're looking for. But I think we are more likely to think, wow, he just did that out of nowhere, even for a cat.
Yeah.
He didn't. The facial expressions, again, these are kind of similar. Big, wide moon eyes or whale eyes, big, wide open eyes. Their ears out to the side, airplane ears, or pinned back, and a tight, kind of squinched up mouth. And you can usually tell that more by their whiskers. They don't have those happy cat forward whiskers. They kind of have a tight face. Body postures, they could have that same sort of sleepy face. You've seen that, right, where they're kind of squinting and hunching, very much tucked, hunched, trying to make themselves as small as possible. Frozen, that escalates up to trying to escape. A cat trying to escape is very obvious because they are quite literally sometimes pinging off the walls. A cat in a state of panic is very sad.
Yeah, they're trying to climb up the walls.
They're trying to climb up the walls. They're trying to get away. Speaking of the videos that you were talking about, for cats, I feel like our challenge is these are presented as funny videos a lot of the time.
Yes.
You know, he's climbing up the wall. He's hiding in the sink. You know, that's not really...
He knocked everything down. He scratched me up when I tried to get him. And
yeah, he's screaming. He's peeing. I mean, it's very much presented as funny.
It is presented as funny.
And it's not.
It's very sad.
They might have their tail curled all the way around them. I mean, most of the time they're trying to make themselves small. And then you're not going to miss it again when a cat is high FAS. It's this offensive behaviors. Most cats, even the ones that have sort of been pushed multiple times past their threshold, are still more likely to try to escape first. It's even more rare for them to go up through the ladder. I think we just give them that opportunity more than we do dogs, to where we don't corner them as much. We have a little bit more natural respect for all of their pointy parts, which is a good thing, because it just, even if it's for the wrong reason, it means we listen to them more.
Yeah.
But sometimes...
but on that note, I also think that the owners seem to understand it more as well. Like, they understand that the cat, they might not use the right verbiage, but yes, there's something wrong. He bit me on the way here.
Yes.
Like, understand that there is this level of stress that they may not totally understand, but it's happening, where dog owners tend to not relate that as much to the dog.
It's true. I think that, and this is a whole conversation, but I think that we tend to see our cats more as individuals and our dogs more as extensions of ourselves. So, like, why are you nervous, Fluffy? It's fine. We're like, of course the cat's nervous. I mean, look at him. Yeah. So I think he
tried to bite me on the way here.
Yeah, he tried to bite me. There's blood of the last vets on his carrier. Yeah. So we respect them more. But we all know what this looks like, right? The Halloween cat with the arched back and the puffy tail, swatting, biting, hissing, growling, all of these things. We know what that looks like. Mm-hmm. These videos are also presented as funny, by the way.
They're presented as funny. A lot of this stuff is presented as funny.
It is.
Yeah. I saw one the other day with a dog where a gentleman was holding his probably 6-month-old baby in front of his husky, and he kept putting it in front of the dog's face, and the dog kept side-eyeing, and ears were back and paw was up, and then would kind of try to scoot back, and Dad kept trying to put the dog or the baby in the dog's face, and it was not one about the dog did not try to bite the baby. It was a very good dog. But you could see all of the very, very simple signs that he was displaying. It was really quite sad. I was like, please stop doing that.
Please get your baby
Please get the baby away from the dog. The dog is scared. The dog doesn't like the baby. Okay, so FAS 0. What does a happy cat look like?
A happy cat comes up to you. He's got relaxed body language. They're usually kind of tall and loose.
Are they trying to rub on you?
They're trying to rub on you. Their tail's usually straight up in the air. That's a good thing. When cats' tails are straight up in the air, it's good. It means they're happy. When their tails are twitching or low or wagging, that's not a good thing. That is an upset cat. So if you're like, oh, my cat's wagging at me, danger.
Cats don't wag.
Danger. They don't wag. They twitch. It's very different. But up tail, sometimes it'll vibrate just a little bit. They want to rub their head on you, or they're showing you their butt to scratch. They want to interact. Cats really like when they're happy. If you go about 3/4 of the way towards their nose with your finger straight out, they'll want to boop it, because that is like a handshake when cats boop each other or you like that. So if you offer them, do not stick your finger in their face. That is not what Dr. Megan is saying. But have a finger nearby.
Give them the option.
And
then they'll
boop or rub on your hand.
Yeah. It's very sweet. Take treats.
Sometimes
it's hit or miss with cats, but those cats will take the churu.
They'll take the churu. Now, if they just are not, if they sniff it and they're just not interested, it's probably just not food motivated.
Yeah.
It's the ones who are hunched and won't even look at it that you're like, they're not even thinking about food. They're too stressed.
So then same with cats for FAS1. I'm not going to say not as ebullient.
You just did.
They're not as ebullient. I don't know what that word means, but I'm surmising that it means they're just not quite as outgoing and wanting to interact.
Yeah.
And
that's a big word for Elmo.
Yeah. They're not FAS0, but they're still friendly and calm. It might take them a little bit to warm up, but they will. They might come out of their carrier after a couple of minutes. They might come out of the corner. They might come up and eventually boop.
They also might just be more relaxed. Like, I'm not going to come up to you.
But I'm just here relaxed.
Just laying on the heating pad, gazing out the window. If you come up to me and offer a boop or a head scratch, I'm good. I like that. I enjoy it. I'll rub on you.
So maybe not as outgoing.
Yeah, that's what ebullient means.
Not outgoing. Is that the definition?
Yeah.
Okay.
Yeah.
All right. Try to dumb our way through that.
Good job.
Me, not you.
Yes, you should context clues. Kids, if you're reading and you find a word you don't know, you should use some context clues to establish the definition like Jessica did here.
Yes.
Okay, FAS2. Again, this is very much like dogs. This is where we're getting some subtle signals. We're not terrified. We're not climbing the walls. We're not hunched in the crate hiding, but we might get some mild avoidance or reluctance to approach. We're not the relaxed cat on the heating pad, FAS1, who's just not approaching you because they are big and happy and couldn't care less. You offer them a nose boop, they probably won't do it. They're not going to swat or go away from you, but they might just look at you like, I don't think I want to shake your hand right now. They might have a few of these. They might have airplane ears. They might have a mild tail twitch. They're in more of a hunched, not completely hunched and frozen, but more of a defensive body position. They're probably a little bit tighter. Their tail might be curled around them. They're just being watchful.
Yeah, it's a good word. Being watchful.
Yeah, it's another big word for Elmo. Yeah.
Okay, FAS3s. We're back to frozen. Frozen in place.
Let it go.
So we are frozen, unwilling to approach, tail curled around them, whale eyes, airplane ears, furrowed brow, tense, all of these things. But again, the owners might say, we're just laying there.
I feel like I hear that even more
He's
for the cats.
He's fine, right? Especially because the cats oftentimes are just laying there, and then you have to kind of decipher these very small other body languages to then determine if they're 2, 3, or 4.
It's like to find the difference in these picture.
There's 17 differences, and you need to find them.
Yes, and I will give this cat a vaccine and not that one.
Exactly. So one might say these subtle stress signals are even more important in cats in terms of really trying to identify them.
And these FAS3 cats, I'm not saying this necessarily about dogs, these FAS3 cats are probably not going to escalate. They're just going to sit there and continue to be terrified, which means if you really want to, you can get it done. It's very sad. Very sad.
And we're not going to do that.
We don't do that.
But that's where, a lot of people will, and historically we have all done, is force the care on these cats because they're just sitting there. And these ones are probably, again, if you're looking for ways to decipher, FAS1s and probably 2s are not, if we're at the vet, they probably have come out of their crate. They may not be approaching you. They may not be totally thrilled to come interact with you, but they usually have come out of their crate to explore the room, especially when you're not in there. They want to kind of look around, and then maybe they get slightly more apprehensive when you come in. The 3s will not usually come out of their crate on their own. We're usually taking those crates apart, putting them up on a table in the bottom of the crate.
And letting
them stay in the carrier, kind of sort of hiding in there the best they can.
Yeah.
Maybe put a towel over them. Okay, do you want to just combine 4s and 5s?
Yes.
Okay.
Once again, we'll combine 4s and 5s because the feelings are the same. The outward expression might be different. And these are your, I am trying to get away from you, FAS4. I am climbing the walls. I'm getting in the sink. Constant movement. You know, the 3s stay in their crate. The 4s might stay in their crate until you try to do something. And then they're going to try to get away from you. Or really just digging into the crate, underneath the blanket, underneath things. They want to, if you have a bench that the cats can get under, we don't. But if you do, they're trying to get under the bench. Mm-hmm. They're trying to get up on the shelf. A lot of motion. And then FAS5, hissing, swatting, growling, biting.
Don't pet their belly.
Don't pet their belly. Ever.
Even a defensive.
Ever. Even the FAS0s, because they flop, is a very happy cat. They'll flop on their side. Their belly is out and exposed. That's very comfortable. But they don't like their belly pet. Even the 0s, especially not the 5s. That's a defensive position.
Which I learned.
They all their pointy bits out.
Yes. Like 6 months ago.
Yeah.
My cat actually doesn't mind his belly being rubbed for about 30 seconds. But he's there like this, ready, just in case something goes south.
Yep. I have one cat who likes it, but that's my cat at my house. If he did it here, I would absolutely not pet his belly.
Yeah. Yeah. So for the 4s and 5s, really for our cats and our dogs, we do not generally see a lot of these behaviors, again, because of our PVPs.
Right.
Unless it's a new patient to us, then we tend to do visual exams only, have them come back in 3 to 5 to 7 days, I guess. Have them come back in 5 to 7 days on the PVPs so that we can get them down to a lower FAS. I know you have some agreements with some cats.
I do. I would like to talk about one of my favorite cats. His name is Baby. And we have a very, very specific agreement. He is technically an FAS5.
He is about 20 pounds.
He's about 22 pounds.
22 pounds.
Around there.
Mm-hmm.
It fluctuates 20 to 22.
Big, solid cat.
Very solid cat. Mm-hmm. And what's interesting about Baby is Baby can't take any oral medications at home.
He can't go in a carrier.
And he cannot, under any circumstances, see a dog. He does not like dogs, which is fine. It's fair. Cats don't always need to like dogs. His owner does not have any dogs, so that is fine. Mm-hmm. He loves his dad. He tolerates me because we have a very specific arrangement. But I think Baby's really interesting because he can't have any pre-visit medications. He actually cannot because they cannot be administered. Because that's part of the arrangement that Baby has with his dad.
Which is ironic because Dad can give him his insulin.
Yep, he's diabetic. He gets insulin injections. When he needs medications, we give them to Dad in an injectable form to give. So Baby gets the care he needs for sure. But
yeah,
but Baby will let me, as long as I follow his rules, give him 1 injection and listen to his heart. So we do that when he gets here, and then we sedate him for the rest of his care with the 1 injection. So we have a very specific agreement. He doesn't like his head covered, doesn't like being wrapped in a towel, he doesn't like any of those things, so I have to give him some trust. But we have an agreement, and if I don't do it right, he just scratches me right in my little fat right there.
Just a little
tap, nothing real.
Just a little like, hey doc.
Just a little bit like, oh, that wasn't correct. And I'm like, okay, that was wrong, I'm sorry. But we have a whole arrangement, but I think somewhere else they would maybe not treat Baby as nice or find it as cute, genuinely, as we do.
Yeah. Yeah.
Because I think all of us here like finding those specific ways to work with a patient.
It's very satisfying.
It's fun.
We get to help them.
It's fun.
Where a lot of these patients actually just wouldn't get the care.
Yeah.
Okay, do you want to go through our small mammals and reptiles?
Yes.
Okay.
If you've been waiting this whole time for our rodent and reptile talk, you are in luck because here we go. Except for ferrets, who are a predator/prey species like cats and dogs, all of our small mammals, chinchillas, mice, rats, hamsters, etc., are prey species only. So it does not behoove them to show us a lot of signals that they're scared. They are more likely to try to flight first. They're going to try to get away from you first. And it's very hard to hold them when they're trying to get away from you. And unfortunately, rabbits especially, at some point will just die. They will be so scared, they will die of fright. Because it is their evolved defense mechanism to keep themselves out of pain if they're getting caught by a predator. So, obviously, there's no coming back from that one. So, you've got to try to keep them as calm as possible. And there is an FAS scale for rats and a lot of info about bunnies. Otherwise, they're not going to give you as many signals, but you can tell if they're not trying to get away from you and they are kind of have a relaxed body position that they are doing okay.
And we will use PVPs for them.
We could definitely use PVPs for them.
Yeah.
The stress signals in reptiles are a little bit less external than mammals because they don't have intraspecies social groups. They tend to be quite solitary. So they don't have quite as much communication as dogs, cats, and small mammals do, because what those animals are doing is they're talking to us, communicating with us, I'll say, like they do with each other, but reptiles don't have as much of that. They have some. Bearded dragons have a little bit more, but they just don't have as much. And you could think about that, like your snake doesn't really have a facial expression, genuinely. They don't have them. They don't need them in their species.
Okay.
So they will usually go very quickly through, trying to avoid, okay, I'm just going to bite you, because that's what they would do with each other. Like I said, bearded dragons have a little bit more. They'll turn black. They'll get a black beard. They'll do the beardy wave if they're being submissive, where they kind of wave their foot like that. They'll bob their head, but a lot of them are going to just do either flight or fight. Ironically, a lot of them won't bite you. They tend to be, if they're well handled, not actually very bitey, but they do go through that ladder. They're also very easy to keep happy if you just kind of keep them warm and move slow.
Yeah, they like the heating pad.
They don't really see us a lot of times as predators like the small mammals do. As long as you're not swooping over their head and looking like a bird, they don't really think of us as predator-like. So they usually do quite well if you keep them warm and move slow.
So for our reptile friends, though, we don't generally do PVPs.
There's not really a lot of research on the PVPs. What we tend to do for them, since we don't really know yet how well that's going to work, and since they're not going to really show us if they're stressed, we're not really going to be able to tell. So if we're going to do something that's going to be painful, or if they seem stressed and avoidant, we will just sedate them, because we know that's going to work.
Yeah. Okay. So this was a lot of information.
Yeah, a lot of information.
A lot of good information. Between episode 1 and episode 2, you are well on your way to really understanding your dog, cat, reptile, guinea pigs, body language.
Yep, because you can't know what to do about it if you don't know what they're saying.
What it is.
It is, yeah.
So one of the things that we've done is, for those listeners that are not clients of ours, whether that's because you have a different clinic in Spokane or you don't live in the area, is we have created a fear-free benchmark questionnaire. And the hope with this is that after your vet visit, you answer these questions to see how they kind of stack up to fear-free and low-stress experience. And if you can't answer yes to all of these questions, then you should ask them some questions. You should start to talk with them about, how can we help alleviate some stress? I've been working on learning the body language. If I can tell you what they're showing, could you help me with PVPs? Could you not make my dog walk into a crowded lobby? And just start to have these conversations with your vet. That is how you can help get fear-free in some of these vet clinics that aren't currently practicing it. And if they're not willing, then it might be time to find a new vet clinic. And I hate to say that, because we very much are big on loyalty, but your pet's emotional well-being is that important, that you find someone who will respect it and respect you advocating for them, and really help you on your low-stress journey for your pet.
Because even if they're not fear-free, they should at least be open to some things that you're suggesting for your patient,
right?
Your
like,
pet.
Could you give me these meds? Can I call from the parking lot and not sit in the lobby? I'm willing to wait until my exam room is free. And then once we're in there, I understand if I need to pay for my exam, even though we've not been totally successful, and then maybe I could come back on a different day to do something different, and just start to have these conversations in vet clinics. That's all you can do. Start having these conversations, get them aware of it. Some clinics still don't even really know what fear-free is.
That's really sad.
Yeah.
So go to our YouTube page if you're not already watching this on YouTube, and click on the link for the Fear-Free Practice Benchmark. We'll leave that in the show notes as well to be able to get to our YouTube page, if you're not watching it on YouTube.
And you can also sign up for our Fear-Free 101 checklist. Both of these both of these will subscribe you to an email list where you will get continued emails in regards to fear-free. All fear-free, all the time.
Always.
That's
us.
That's
if you haven't got that by now.
Yeah.
Okay. And then we're each going to go ahead and share one of our favorite stories that happened recently. We haven't had any submissions yet for questions. So let's get on that, guys. So we're going to go ahead and each share one of our favorite things that happened recently. So one of my all-time favorite clients got a brand new puppy.
Little wiener dog.
Little cute little Maggie. And, when we put the bandana on Maggie, she seemed fine with it and she was doing good. And then she started kind of scratching it and kind of tugging at it with her teeth. And I said, oh, I don't think she likes her bandana. And Mom was like, how can you tell? How can you tell she doesn't like it? How are you reading her mind, basically? And said, no, she is telling me. I'm reading her body language. She's kind of telling me because, as I'm telling you, it sounds quite obvious. These were very subtle little signals that she wasn't panicking. It was just a little bit of like, oh, what is this? But we were able to say, oh, I don't think she's had something like that on before. I don't know if she likes it. So that gave us a great opportunity to start educating Mom about body language, which we will continue to do at all of our appointments because she's awesome and she's very interested and she wants to learn what Maggie is trying to tell her.
Nice.
Yeah.
Nice. Just the one thing that I just wanted to mention is, speaking of puppies, it is not all about puppies and kittens, but we do see a lot of puppies, and we just try to really make sure we get them started on the right foot. And one of those things for us is letting them see the clinic, because oftentimes when they're here for their vaccines, they're in the exam room, they leave, and that happens a few times, and then they come back a few months later to be spayed, and they're just terrified because they're back in treatment. And we can tell they're terrified because they're showing more than subtle signs of stress. So what we do at each of our puppy visits, when the appointment is done, the assistants will walk them back through treatment. And everybody back there can read the body language of the puppies and can tell if, are we FAS 0, are we FAS 2 or 3, because some of our puppies are scared, which is okay. We're working with them. But we each then will approach them or let them approach us with treats to kind of give them a good experience back in treatment.
Or not, right? Sometimes they just walk through and get treats from Mom and Dad, and we stay back, and they just get to see us from a distance.
Yep, we kind of have to take the lead of the assistant bringing them through treatment. Like, yep, come on, you guys can each give them treats, or if everybody could stay back a little bit because we are a little bit nervous. But that is just something that was recommended to us a couple years ago. Like, hey, do you guys do this? And we thought that's a great idea.
Yeah, because we do everything in the exam rooms, which is awesome.
Yeah.
But sometimes they are going to have to be in treatment, like you said, when they get spayed or if they get admitted for the day and Mom and Dad can't stay, then they'll have to be in treatment, and we don't want them to be 18 months old and have never seen it.
Yeah. Yeah, it makes them stressed.
And like you said, gives us a good opportunity to read their body language in a couple of different situations to help educate Mom and Dad too.
Yeah. Yeah.
Yeah.
Yeah.
It's a good one.
It's a good one.
It's a good one.
So does that wrap up this month?
That's it for this month.
Okay. Well, as always, if you want more information about all things fear-free, you can find that on our YouTube channel at Latah Creek AH. You can also find that on our Instagram channel at Latah Creek AH. And we also have our Facebook page at Latah Creek Animal Hospital.
All right. Thanks for tuning in.
Okay. Thank you.
Because your pets deserve it.
Your pets deserve it. Bye.
Bye.